Hi, good afternoon, everyone. My name is Lavisha. I'm a senior resident from Anatomical Pathology in Sing Health. I will be the moderator for today's Pathology ACP lecture series. It is my pleasure to introduce today's speaker, Associate Professor Renzo Guinto from the Sing Health Duke-NUS Global Health Institute, Duke-NUS Medical School. Associate Professor Guinto obtained a doctorate in public health from Harvard University and a doctorate in medicine from the University of Philippines, Manila. A pioneer in planetary health and Southeast Asia's leading voice for climate and health, he specializes in climate resilient healthcare systems, climate change's impact on mental health, and the intersection of climate with global health. He serves on the World Health Organization's Technical Advisory Group on Ethics of Climate and Health and is an editorial board member of the Lancet Planetary Health. As an Obama Foundation Asia Pacific leader, he has consulted for organizations including WHO, World Bank, and USAID. He has published over 200 articles and lectured in nearly 70 countries. His contributions to planetary health have earned him recognition as one of the outstanding young men and women of Philippines in 2022. This year, he was awarded the inaugural Kiyoshi Kurokawa Award by Japan's Health and Global Policy Institute for his extraordinary contributions to health policy and innovation in the Asia Pacific region. We are glad to have him today to speak to us about pathology and planetary health. He will be unpacking some of the connections in his lecture. Welcome, Associate Professor Guinto.
Thank you so much, Lavisha, and thank you very much to the Pathology ACP of Sing Health, Duke-NUS Academic Medical Center. Of course, special thanks to our friend, Dr. Jabed Iqbal, for making this happen. And I'm really glad that we have, colleagues from the pathology community who are interested in this pressing, topic and challenge, planetary health, climate change, the climate crisis. And as you mentioned, Lavisha, I'm going to give justice to this unpacking of the connections. And so I just want to give you a heads up in advance. Obviously, as mentioned already, I'm not a pathologist. I am looking at pathology from the perspective of planetary health. I'll be sharing with you some of the emerging developments in the planetary health space. And I'll provide some initial ideas as to how, pathology and laboratory medicine can play a critical role in addressing some of these existential planetary challenges. So I hope that during the Q&A and in the discussion, you can also share with me what you think are the different roles that pathologists and colleagues from laboratory medicine can play in order to improve not the health not only of people but also of the planet. And I want to begin by, defining the phrase planetary health. Many of you might be wondering, what is this planetary health? You may be intrigued when you saw that in the poster of this event. I'm sure you're more familiar with the concept of public health or population health. When we say public health, we try to protect and take good care of the health of the human population, of the people. But oftentimes in medicine and public health, we focus on the human patient. We forget about the other important patient, which is the planetary patient. And as I already alluded to, we're now facing a lot of different problems, climate change, pollution to the air, water, and land, among others. And I always say that even the planet itself is sick. And we need to also start thinking about how do we restore the health of the planet, how we heal the ailments of the planet, because our health, the health of people, is greatly dependent on the health of the planet. In fact, the health of the people and the health of the planet are inseparable. So I want to emphasize that when we talk about planetary health, we now have two patients, not only the people, but also the planet. And I'm coming from what I always mention or say as a pracademic perspective. And actually, a lot of us in healthcare, I'm a physician by training, and many of our colleagues, I think from here in the room, in the virtual room, are physicians, are clinicians, and we do both academia and practice, right? One foot standing on the university, on academia, and the other foot standing on practice, and really, when we talk about addressing the health of the people and the planet in which we live, in which we thrive, we must embrace this academic orientation and approach, trying to bridge the world of the university and of research and academia and the world of practice, whether it's clinical practice or practice in public health and in all spaces within the arena of the health sector. So and you may be remembering, especially to the physicians, the healthcare professionals in the room, when you entered the medical profession, you certainly made an oath, recited the pledge, the physician's pledge, the Hippocratic oath. And during that time, you made a commitment to do no harm to our patients, and particularly our human patients. I think in the era of planetary health, we're now being called to also make sure we're not harming the planetary patient. Mother Earth, as I've said, is already sick, and we don't want to add insult to the injury. And I want to invite you to this Lancet commentary that I co-wrote at the start of the pandemic. We re-envisioned the Hippocratic Oath and turned it into a planetary health pledge of health professionals in the Anthropocene. Another concept that may be new to you when we say Anthropocene. Anthropo means man. Because now in this day and age, all the changes or many of the changes we are seeing around us in the environment are driven not by natural phenomena, but by human activities. Again, the term is anthropogenic. So we live in the era of the Anthropocene. How do we improve the health of people and the planet in the Anthropocene? That's what this pledge is about. And, the concept of planetary health, again, as I've said, maybe it's the first time you're hearing the phrase, but it's really not a very new idea, this recognition that the health of the planet and its people are connected. In the early 1990s, there's this Australian epidemiologist, Anthony McMichael, one of the first to write about climate change as a health issue. He said in the 1990s that the health sector must lift its gaze to bigger ecological horizons. This will require a radical extension of the public health agenda. And I think that radical extension that he was referring to in the early 1990s is what we now call the planetary health agenda. And then fast forward at the bottom, you will see in this quote that he is encouraging us to develop an ability to collaborate with unfamiliar disciplines such as climatology and ecology. So I always remind our learners, our medical students in Duke-NUS and, in everywhere I give a lecture about planetary health, I always say, and I always urge that by the time they graduate from medical school, by the time they, finish their medical education, they should have at least 5 new friends who are not from the field of medicine. Maybe one is an environmentalist, another is an economist, another is an engineer, because we really need to work with these quote unquote unfamiliar disciplines if we want to address these pressing planetary health challenges. And then, as I also mentioned, again, it's not a novel invention. We just need to look at indigenous wisdom, indigenous cultures, ancient traditions. Many of them are actually, based and located here in Southeast Asia. And we will discover that this idea that the health of the people and the planet are deeply integrated, again, not a novel invention. It's as old as humanity itself. And I just want to quote an indigenous leader from the Americas, Chief Seattle. He once said that the earth does not belong to man, man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. So whichever harm or damage we inflict on Mother Earth, all of these will return to us in the form of human disease, despair, disability, and sometimes even death. That is the planetary health message. We harm the planet, and those impacts come back to us, affecting our health and well-being. So, I'm in medicine and public health. We have many different ways for measuring the health of, the domestic population or the global population, life expectancy, child mortality, maternal mortality ratio, among others. But there is also a way to measure the health of the planet. And I want to introduce to you this framework called the Planetary Boundaries Framework. When you say something is a boundary, a limit, you cannot go beyond it. You cannot transgress it, because if you do so, then something bad happens. And that something bad is that the planet becomes less conducive for human survival. And so the Stockholm Resilience Center in Sweden, which developed this framework, identified 9 planetary boundaries, which you can see in this diagram. And unfortunately, according to their research, out of the 9 planetary boundaries, 6 have already been violated or transgressed or breached. And these are the boundaries that have already been violated. The boundary for climate change, we've been emitting enormous amounts of carbon and other greenhouse gases into the atmosphere, which led to the rapid destabilization of the global climate system. And that's why we're complaining about hotter weather or all these cyclones because of climate change. But also biosphere integrity or biodiversity. Over the past century, we've seen the fastest rate of extinction of creatures great and small. And we know that, rich biodiverse ecosystems are critical for the maintenance of, our food systems, for example. It's from forests that we, acquire our natural medicines, for instance. So, biodiversity is so important for human health as well. And then land system change, we've been turning every natural habitat into, a new city, a new building or a golf course, etc. We're humanizing the natural planet or the natural environment. Freshwater change, our rivers and lakes are now not only overconsumed, but also over-contaminated with all the trash and the chemicals that we're releasing into them. Biogeochemical flows, the natural flows of important elements like phosphorus and nitrogen, also now, disrupted and even destroyed because of, our global addiction to artificial fertilizers in the name of large-scale agriculture. We've been releasing all these artificial chemicals to the soil, to the waters, etc. And last but not the least, the 6th and the latest planetary boundary that has already been violated is the boundary for novel entities. When you say it's novel, it's new. These are new compounds and chemicals that we invent in the laboratory, we manufacture in the factory, and we release to the environment. And one of the greatest examples of this is plastic, because now plastic is floating in our oceans, and Southeast Asia is actually a plastic pollution hotspot. But also it's now flowing in our bloodstreams. And, there are recent studies showing that microplastic is not now detectable, not only in blood, but also in the gut and even in the brain, at least in mice models. And, for the pathologists in the room, this is going to be very interesting. How are we detecting and diagnosing these chemicals, these pollutants that are now already existing inside our bodies? They've violated not only the planetary boundary, they've also violated the human boundary as well. So 6 out of 9 planetary boundaries already exceeded. This should be a cause for alarm for the health sector. We should be acting as if we're in the emergency room. And the situation is becoming worse over time. When the planetary boundaries framework was first introduced in 2009, only three boundaries have been crossed. And then in 2023, six have already been transgressed. And you can just imagine the situation now. I hope that we are able to reverse these planetary boundary transgressions. So this is the situation of planetary health on which human health greatly depends. So now in the next several slides, I'll focus on one of the six planetary boundaries that I highlighted, and one of which is climate change. We know that climate change is now worsening, even accelerating. Climate action is very slow, despite all the talks for example, the UN climate negotiations. This November will be the 30th time the governments will be coming together again to negotiate about the future survival of our planet and its people. And we need to really cut this continuous talking and really start acting. Because climate change is already affecting human health. It's not an issue for tomorrow. It's already an issue that we are now experiencing. And as you can see in this diagram, there are many pathways that link climate change to human health, whether through storms or drought or flooding or even heat waves. All of these affecting the social and the environmental determinants of health, which ultimately affect a wide array of health outcomes. And as you can see in this diagram, there's no single disease group that is going to be immune to the impacts of climate change. You name it, infectious diseases, chronic non-communicable diseases. The nutritional gains that we've achieved globally are expected to be reversed if climate change is going to worsen. And even mental health, the health of our brains and our hearts is greatly shaped by what's happening around us, by the changes in the environment. And so climate change is also a mental and emotional health issue as well. And so, our region, Asia in particular, is really at the heart of the climate crisis. In 2023, a UN report said Asia is the most impacted by extreme weather and climate disasters. And now, the cyclones, I come from the Philippines, and we are now experiencing and witnessing the increasing not only frequency but also intensity of the cyclones coming from the Pacific. And so these are going to be the major challenges moving forward. And it's not only the wet phenomena of climate change that we should be paying attention to, even the hot and dry phenomena. And, right now, as we speak, the weather in Singapore is not that bad, but in other parts of Southeast Asia, like in Manila, for example, the heat wave season has already begun, and we know that this region will continue to be a hotter and hotter place over the coming years and decades. And so, what are we doing as health professionals to heat-proof our communities, our patients, our health systems, while at the same time preparing also for the wet, catastrophic events such as typhoons and flooding? So now that we know how climate change is affecting human health, what is the situation when it comes to the health of the planet, and our health is deeply connected with it, the question now is, what is the role of the health professional, and in particular of pathology? Because we're talking now to our pathology friends. What is your role in planetary health? And I came up with this framework. I was able to identify at least 5 areas, and maybe later on during the discussion you might be able to identify more. So let me just enumerate these 5. One is resilience, right, or adaptation. How can we be better prepared for the impacts of climate change on human health? And this is a question for all health professionals, for all clinicians and physicians, including pathologists. So later on, we'll be doing a deep dive into this first bucket. The second one is sustainability, environmental sustainability, climate mitigation. That's another related concept. How do we reduce our environmental footprint, our carbon footprint? How do we decarbonize as a health system, as a profession, and even as a clinical specialty like pathology? The third one is advocacy. Physicians, health professionals are the most trusted of all professions. We've seen that during the pandemic. How can we use the power of our voice, the power of our science, and the power of our stories and example to influence the broader, discourse and to drive rapid and sustainable climate action across society? The fourth one is education. How do we educate ourselves? How do we educate our future pathologists and physicians and health professionals? And how do we educate the broader public? And finally, research, because we're in an academic medical center and we need to continuously generate new evidence to inform, in fact, the other four, right? To inform our resilience measures, to inform the way we practice sustainability, to inform the evidence that we will use for advocacy, and even to reshape education moving forward. So these are the 5 roles. I'm happy to hear later what else are you thinking about and if you agree with these 5. So let me just do a quick deep dive into each. When we talk about resilience, again, adaptation, like the bamboo, which we have lots of here in Southeast Asia, bamboos bend without breaking. How do we bend without breaking as we face climate change? How do we make sure that we are the last sector standing when climate disasters strike? How do we make sure that pathology continues to function and operate even in the face of climate disasters? And these bar graphs just show to you why we need to do resilience building, why we need to do adaptation. I'll not go into the details, but as you can eyeball, just by eyeballing these diagram, you will see that climate change results in lots of, loss of life and loss of health. That's what you measure with valleys and deaths, but also the economic impact, right? Healthcare spending is going to increase, and the economy overall is going to bear these additional diseases and deaths resulting from climate change. And so it's imperative for us to be better prepared and to be adaptive. And, I already alluded to some of the climate impacts a while ago, but let me just highlight one area which I think resonates a lot with our friends in the pathology field. One is, the impacts of climate change on infectious diseases. And we know that climate change is going to affect the epidemiological triad. It changes the way the pathogen behaves. It is changing the environmental conditions in which the pathogen does thrive. And it also changes the host. In fact, we know little about how, for example, extreme heat is going to change the way our immune systems will respond to pathogens that enter our body. So this is, in fact, an area of research. And as you can see at the bottom, climate change will lead to an increase in the frequency and severity and spread of established and familiar infectious diseases, the dengues, the malarias, the Zikas, many of them are vector-borne diseases. But it will also climate change will lead to the emergence of new infectious diseases that are still unknown to us, but they're lurking around in wildlife, for example, just waiting for, that zoonotic spillover event to happen. So it jumps from the animal population to human beings. And of course, COVID-19 is one example. So just more additional, illustrations on why infectious diseases are important when we talk about climate change. Dengue is now spreading. You're now seeing dengue even in parts of the world where they used to be non-existing, like, North America or some parts of Europe. Of course, in Southeast Asia, dengue is endemic. We've been trying to control and prevent its spread, and that's why, for example, in Singapore, we have where we introduced the Wolbachia as a form of a biological control, of dengue. But this is going to be a climate and health priority moving forward for many parts of the world. and even diseases that are not so much directly related to climate change. But we know climate change is going to exacerbate these conditions because it's affecting our water systems. It's affecting our housing conditions. Climate change is going to affect the way people move and also crowd, and come together. And tuberculosis likes communities that are, dense with little hygiene and sanitation occurring, and also with weak health systems. And so we also need to apply a climate lens even to disease conditions that are not directly related to climate change. And then, as I already alluded to, climate change in itself can spark the next pandemic. There are many drivers of emerging infections: wildlife trade, urbanization, agriculture expansion, deforestation. But climate change in itself is also going to, disrupt the behavior of wildlife, of disease-carrying mosquitoes and other vectors, which can then lead to what we call a zoonotic spillover. And as you can see in this map, Southeast Asia is a hotspot not only for infectious diseases, but also for climate change, for biodiversity, and a potential future ground zero for a future pandemic. So given that situation, again, we need to enhance the resilience and adaptive capacity of the health sector, of the health system. And as you can see in this diagram, we need the health system to not collapse, but instead to recover, and recover better than before, and even transform when a climate-related shock, such as, a cyclone, a flood, or a stress. For example, when there is an aberration, in the spread of an infectious disease. When these occurs, we need to make sure that the health system continues to operate and that the health system does not collapse. And many of the things that we need to do are already familiar to us, right? Which are listed on your right. We need to invest in, health, promotion and prevention. We need to address the social and the environmental determinants. We need to empower the health workforce and, engage the community. So these are not new things, but we need to do them better and maybe faster in order to enhance and accelerate the building of climate resilience within the health system. And we need to do that across the different, what we call building blocks of the health system, right? For those who are in public health, you're more familiar with the building blocks framework. When we say building blocks, we're talking about governance. We're talking about the health workforce, which includes all of us here. We're talking about our health information systems. How do we make sure health information is integrated with climate information so we can come up with, evidence to inform our decisions and our planning? But also our services, that's another building block. Our supply chains like medicines and devices, and even the reagents that we use in pathology. These are all important as well. And also what's the last building block that I haven't mentioned yet? Financing. We need to make sure that there's adequate financing for the health system so that we can withstand all these climate impacts. And, I've been trying to look for some evidence on the vulnerability of our laboratories, especially in Southeast Asia, in terms of, climate vulnerability. But there's no such study that has been conducted yet, and maybe that's something we can explore. But there's a similar study that assessed the hospitals across the region. And of course, as we know, hospitals have or host the laboratories. And as you can see here, Southeast Asia, in fact, has the highest percentage of hospitals that are at high risk of damage from extreme weather events due to climate change in the world. And so, this is so important, right? This is why we in Southeast Asia should be talking about building the climate resilience of the health sector, including our hospitals and laboratories, because we're really at the very heart of the planetary crisis. So I'm done now with resilience, and now let's talk about sustainability. how do we make sure that, healthcare, that pathology practice is not harming the planet? Remember, we said in the Hippocratic Oath, we will not harm the human patient. We should also not harm the planetary patient, that we are contributing to the decarbonization of the world so that we can delay, if not totally stop, the worsening of the climate crisis. So how do we do that? First, we need to know the carbon or the environmental footprint of healthcare. And there are many different studies that have been published. The global estimate is that 5% of the total greenhouse gas emissions of the world is attributable to the global health sector. But at the national level, you have national level estimations. For example, in Australia, they say that around 10% actually of the country's emissions do come from the health sector. And I think for Singapore, we are still doing a carbon footprinting of not only Sing Health, but also of the entire Singaporean healthcare system. But we can say safely that it is a significant number because we are a high-income country with a very intensive and advanced healthcare system, unlike in our neighboring low and middle income countries. And as you can see in this other report, the majority of the emissions do come from electricity generation and also, the other operational emissions. But there are also other sources. And I want to share, this next slide because it shows to you the different sources of greenhouse gas emissions within healthcare. Scope 1 refers to emissions that are generated within the health facility. So if your health facility has, its own power plant or, the anesthetic gases that we use in the operating theater or the refrigerants that we also use, these are all directly emitting greenhouse gases within our own backyard. Scope 2 pertains to emissions that are emitted elsewhere outside, but because we're using the electricity that it generated, that was generated by the power plant, then that is emissions also attributable to us. There will be no emissions if we didn't use that electricity. And then the third scope pertains to emissions coming from the supply chain, the supplies that we use in healthcare. So the emission did not happen within the boundaries of the healthcare facility, but because we use that product, like, our pharmaceuticals, devices, the syringes that we use, the IV tubings, and the food that we serve to our patients and staff, all of these also emit greenhouse gases when they are produced, when they are transported, and they should also be counted in our carbon footprint accounting. And so there are many frameworks that exist in terms of how to operationalize sustainable or green healthcare within our healthcare facilities. So, this is one example, the global green and healthy hospitals. And many of the things that I mentioned a while ago are actually its pillars, right? The energy that we use, food, pharmaceuticals, procurement, the design of our buildings, etc. But most important among the 10 pillars is leadership. That sustainability is embraced from the top by our leaders, at the C-suite level or by the heads of our ACPs and other departments and units of the healthcare system. So because when there's buy-in from the top, everything else will follow. So, for example, energy is one area. And, one of my hobbies whenever I go around Southeast Asia and even beyond is to take photos of hospitals that are embracing solar power, right? And I think we are using some renewable energy in Sing Health, but we hope to see more of this moving forward, especially as healthcare continues to expand. And then even in the specialty level, there are many initiatives already happening, many investigations already being done when it comes to the carbon footprint of procedures, of what we are doing within each clinical specialty. I'm just giving you some examples. For example, the surgeons are now calculating the carbon footprint of the operating theater. And then the anesthesiologists or anesthetists are now looking at the global warming potential of inhalational anesthetics. And they were seeing that desflurane is the most climate disruptive of all inhalational or anesthetic gases. And now there's a move to use less desflurane and more of the climate-friendly alternatives. And so you may be wondering, are similar investigations already done in pathology? And my quick answer is it's a very new field. Very few studies have been conducted. So if you know of other studies that I am not citing here, please let me know. But for example, this is an elegant study produced by colleagues from Australia. And what they did is a life cycle assessment of several pathology tests, the common tests that are done in the hospital. And on your right, you are seeing the framework that they use. Basically, because you cannot cover all the sources of carbon, right? There are things that are really way beyond the scope, and even the imagination. It's hard, for example, to estimate the carbon footprint of, the metals, when they were being mined from the mine. And so as you can see in the framework, they did not include that in the calculation of the carbon footprint. Having said that, there are already many aspects of the entire supply chain that were taken into account when they did the calculations. And here I'm just showing to you, some numbers. And as you can see in the first table, they even converted it into how many kilometers of that are being driven by a car, right? That is equivalent to 1,000 tests or being done, right? Or 1,000 of such tests being done. And just by eyeballing, you can see, and maybe this is not surprising, a full blood exam is actually the most carbon emitting, right, of all these common tests. Of course, the paper is not saying we should do less blood exams, but it invites us to think about how, what are the ways we can reduce the carbon footprint of these tests, whether it's in the frequency of them being prescribed or requested, or the materials and the reagents that we use, or how we increase the efficiency of our procedure. So there are many ways by which we can actually reduce the carbon footprint within, among these tests. And the second diagram, the bar graph, is showing to you a dissection, of among these tests, or within each test, what are the different sources of emissions? Is it in the container? Is it in the electricity? Is it in the reagent? So I'm not going to the details. I'm just demonstrating to you what are the emerging studies being done in this nascent field. And more studies here, very interesting. There's one that looked at the carbon footprint of histopathological testing, for example, and I'll not go into the details because we are running out of time. And then there's even a study of the greenhouse gas emissions of deep learning in digital pathology. In fact, their conclusion was we anticipate more carbon emissions as we apply more deep learning in digital pathology, and therefore we really need to think of ways to decarbonize the practice. So I'll be very quick in the last three buckets. Advocacy, which I already mentioned. We need to use the power of our voice. And right now, different specialties are now speaking up, right? The radiologists, the ONGs, the surgeons, the World Medical Association, the family physicians, among others. And even in pathology, I did a simple Google search, and my discovery is that one, there are not that many papers or statements written about the role of pathology. But number two, there's growing interest. And so I hope our pathology friends will here in this seminar, in this webinar, will be interested in pushing for your local and international society to mount advocacy activities in order to raise awareness and to also make sure your voice is being heard by the global community. And we also need to work with other sectors. We cannot work within our own silo of pathology or within our own silo of medicine. We need to work with, people in agricultural sector or in manufacturing and industry, especially as we use a lot of these products in pathology, or the power and energy sector because we use their electricity, the electricity that they produce as well. So cross-sectoral action is vital to advance the health of both people and the planet. And here I'm just showing to you some photos of how I'm personally doing it, working with the media, lending my voice at both national and international levels, even in the climate negotiations, and even in the Philippine Medical Association, which, I still chair the Committee of Environmental Health. So I wonder if the National Society of Pathology here in Singapore also has a committee on climate change and environmental health. And so I hope to see more pathologists, pathology friends joining the climate advocacy. And then when it comes to education, I kudos to the Pathology ACP for having this session, and I hope this will not be the last, because we really need to educate our health professionals about planetary health. And actually, we at the Sing Health Duke-NUS Global Health Institute, we have a planetary health week-long course. We invite you to enroll if you become more interested because of this webinar. Our next edition will be offered in April 2026. So you still have time to register. We just finished an Asia-wide course on climate and health. It's free. And actually, all the recordings are available online, and I can share that with you later on. And we are now designing a future course for hospital administrators and public health leaders on climate smart healthcare. So if our pathology ACP is also interested in a course specific for pathologists, and we want to offer that for pathologists from across the region and beyond, we are more than happy to explore collaborating with you. And, for example, there are many materials already available online. This is from the New England Journal of Medicine. It's a very interactive website. You can click on the organ system, and it will tell you how that organ system is affected by climate change. And we are also developing educational materials even for young people and even for the young at heart. So this is an example. It's a comic book on climate and health that I co-developed with colleagues for Filipino young children. And so we can also do that for Singaporeans, but also for pathologists, right? How can we make climate and health messaging more digestible for our friends in pathology and laboratory medicine? And then lastly, we need to do more research, which I think is already repeatedly highlighted. And I just came up with this initial research agenda for pathology and planetary health. We need to so the columns represent, resilience on one hand, our adaptation objective, and sustainability on the other hand, what we need to do to make sure we're not harming the planet. And then the rows refer to one, clinical practice at the micro level. What do we need to do? And then the second level is the macro level, the facilities and the systems in which pathology operates. And so, at the micro level, we need to understand better these climate sensitive diseases and pathogens that we, examine under the microscope, or that we, subject to various tests. But we also need to find ways to make sure that we are trying to that we are minimizing our environmental footprint as possible, as low as possible. And that's what you mean by sustainable pathology practices. And at the macro level, we need to think about our laboratories, our supply chains, our facilities, making sure that they are ready for shocks, for climate disruption, but at the same time that they are also low carbon, not harming the planet. So to end this presentation, my question to us all is, are we ready to build health systems that consider the climate? Are we ready to become health professionals that care not only for the health of people, but also for the health of the planet as well? Are we ready to have a newly revitalized pathology practice that embraces planetary health principles? And, I hope that, planetary health is teaching us about planetary humility. It invites us to shift away from this ego logical perspective. Oh, we human beings are at the top of the pyramid of nature. We can continue mining, extracting, polluting, killing, burning, contaminating. And instead, we need to shift towards a truly ecological perspective where we human beings live in harmony, in greater solidarity and interdependence with all creatures, great and small, and all the other components of planet Earth are one and only home. And finally, I think planetary health invites us to become good ancestors. What we want is that in 2125, which is 100 years from now, the children of 2125 will read the history books, will look back to the past, and they will say that the pathologists of 2025 were good ancestors to them because you made the right decisions, not just for our own health, but also for their health and well-being as well. Are we ready to become good ancestors and not selfish ancestors to these children and to the future children of Singapore and of the world who are yet to come and who are yet to be born? So together, let's advance the health of both people and the planet. Thank you very much.
Thank you, Associate Professor Guinto, for this very eye-opening talk. I think it was a reminder to all of us to consider our responsibility to the planet, in addition to the responsibilities we have to patients, clinical care, our colleagues in the healthcare system. We have one question in the Q&A box. This is submitted by Putri Neelam Sari. The question is as follows. I believe that using life cycle assessment in healthcare services is very useful to identify activities that represent hotspots or generate the highest carbon dioxide emissions. Are there already alternative, more environmentally friendly healthcare practices that still ensure the quality of patient care, particularly those that are feasible and applicable in developing countries?
Thank you very much. And indeed, a very important question. And actually, whenever we talk about sustainability in healthcare, that's one question that always pops out, right? If we pursue sustainability, are we sacrificing patient care quality and safety? And I think many examples around the world are showing to us, and even here in Singapore, that we can achieve both. We can strike a balance. And in fact, environmentally sustainable practices are also good for the health of patients and staff and of the community, right? If we manage our waste properly, then it will, for example, prevent infection within the health facility, but also will prevent pollution in the broader community, which will prevent us from sending more patients to the health facility. Of course, there are many specific examples, right? And even within waste management alone, there are ways to, one, reduce utilization from the get-go, two, repurpose, reuse, recycle. Three, there's a role for innovation. I think we're now seeing some more biodegradable products that are friendly to the environment, while at the same time good for and safe for the patient. One concern always is it costly? I'm sure we can reduce the cost if everyone in healthcare purchases and demands for these better products, greener products, healthier products. So, I hope this is a sufficient answer, but we can talk about, remember the framework a while ago. There are innovations in the food system, right? There are innovations in products, and there are innovations already, even in hospital building design. That hospitals that are low carbon and low greenhouse gas emitting, but at the same time healthy for patients because they're well ventilated, they are well lit, spacious, and they're improving even the mental health of our staff. So those are some examples.
Thank you. We also have another question from participant Vijaya Manikandan. The question is, how do we balance standardized planetary health matrix with culturally specific slash traditional medicine system specific health indicators?
Great question. And I really like that, I think balance is going to be a recurrent theme, right? Because we're not saying we'll forget about the patient, the human patient. Let's focus on the planetary patient. And that's why I started by saying in planetary health, we now have two patients. And balance and harmony, these are the things that we need to achieve. When it comes to metrics, and yes, right, we need metrics so we can have a baseline. We understand the baseline, where we're coming from, where we want to go, right? The metrics are used for setting targets, and we use that for monitoring progress, right? We want to make sure we are sustaining the good, performance that we are having. And yes, right now, maybe health systems, hospitals, even clinical specialties are using the more traditional metrics of efficiency, cost effectiveness, safety, right? But it's not prohibiting us from adding metrics related to environmental sustainability. Healthcare systems like Sing Health are now using, for example, ESG metrics, reporting, environmental, social, and governance metrics, indicators. And maybe we should highlight more the E part, the environmental. And that means, how much carbon we are reducing, how much electricity and unnecessary electricity use, for example, that we are reducing or avoiding. How much waste are we also preventing from being released to the environment? So there are many planetary health indicators that we can easily add to our existing more traditional metrics. I'll be interested in thinking about more specific metrics for pathology, right? And that's why I urge our pathology colleagues, right, about the research agenda that needs to be developed. And maybe part of it is identifying what are these metrics so that we can assess not only the clinical performance, but also the environmental performance of pathology. I think that will be a great, paper and research project, and also contribution to the field of sustainable healthcare.
Yes, I think that's a very interesting question. I was also myself thinking about specific ways in which one can measure improvements made, because I think a lot of these metrics, like let's say carbon footprint, they can be quite challenging to measure on a practical ground level type situation. We also have another question from Vijaya, and this question is as follows. As a traditional medicine system practitioner, I am interested to know what barriers must be overcome to ensure indigenous governance and decision making are central to implementing climate adaptation strategies that affect community health outcomes.
Thank you very much, Vijaya, for the second question. And now that I'm reading the second question, I understand now what you meant by traditional medicine, traditional complementary alternative medicine. But also in my earlier response, I was referring to the conservative or the more established ways, right? That's another meaning for traditional, right? What are the usual ways we measure healthcare performance? And then now we have to add planetary health. But going now to this question, which is in a way related, because metrics, identifying what are the things that we need to measure will help us overcome the barriers. And when you talk about indigenous knowledge systems, if you remember, one of my first slides was to echo that planetary health is not a novel invention. We just need to learn from indigenous communities, including here in Asia. And this idea that the health of the planet and the health of the people are inseparable, this has been existing for centuries, if not millennia. And so I think medicine is just going back full circle, right? We're now going back to these original ideas of healing and integratedness. And now the challenge is how to integrate this into our new healthcare systems, right? Our new way of thinking about the healthcare system. And one way to do that is by metrics, right? But also to answer the question on barriers, right? I think in a way, I also alluded a while ago to the need for more transdisciplinary collaboration, right? Identifying those five new friends who are not from your field, right? And if we are bringing in the social scientists, those who are working from cultural studies, those who are in traditional medicine, TCAM, traditional complementary alternative medicine, we might be able to find these, seemingly new solutions, but they are in fact age-old solutions, right? Because they have been practiced already by indigenous communities for the longest time, but unfortunately peripheralized by what we call modern science, right? So, and then apart from the transdisciplinary collaboration, we need to go outside of our comfort zone. We need to go outside of the ivory tower of the academic medical center. And maybe Singapore is a bit small. When you go out of Sing Health, that means going to maybe just another kampong, 20 minutes away. But for example, from the Philippines, it means going outside of the capital and going to the rural areas where climate change is already happening and learning from the frontline communities who are already suffering. So, but we can do that also even in the little red dot, right? Because we have communities and communities that are invisible, that are already affected by, for example, heat, right? What's happening to our elderly community? How about our migrant workers in the construction sector exposed to the elements? How about the children, right? Who are in school. So these are the communities, right? And even the indigenous communities of Singapore. I just recently learned that we also have indigenous communities here that need to be heard and that need to be invited to the table.
Questions. Just sort of checking that we don't have
Right.
any more questions. Oh, we just
Thankfully,
have one
there's
more.
no pathology specific question, right? But maybe everybody's thinking now because it's a totally new area of inquiry.
Yes, we've just got one more question coming to the Q&A box. This is from Han Titizo. This question is as follows. What about community level responders in case of emergency and disaster response immediately after the climate impact?
Well, so in many countries that somehow already exists in one shape or form. For example, I come from the Philippines, which is the favorite of cyclones to visit, right? Coming from the Pacific. So over time, the country and its communities have developed capacities, systems, protocols to address, let's say, cyclones and floods. So and it's a continuous learning. There's a flood now, and we learn the lessons, and we try to incorporate and integrate them into our systems. The interesting thing is that yes, the Philippines is ready for typhoons and floods. It's not ready for heat waves. And that's why this morning I just gave the keynote in the Heat Health Forum organized by our Ministry of Health in the Philippines. Meanwhile, in Singapore, I think we have some systems that are ready for heat, even at the community level and even at the national level. And I think there's an opportunity for cross-country learning for Philippines and Singapore and all the other neighboring countries in ASEAN to learn from one another and with each other on how to develop resilient health systems, on how to strengthen emergency and disaster response. So, and maybe, part of the question is how do we involve and mobilize the community? Because we've always seen the community as they are the recipients, they are the patients. But actually, communities, the household should be the first line of defense, right? We learned that during COVID. We always say in COVID, the families are the first line of defense. And we should apply the same kind of thinking when it comes to climate. So looking forward to hearing what people are doing and thinking about in terms of mobilizing the frontline communities.
Thank you. Thank you, Associate Professor Guinto. This was a very, very visionary lecture, and it has really given all of us participants quite a bit to reflect and think about as we go on with our day in pathology. As we've now come to 3 p.m., I'd like to close this session, but I believe if anyone has any questions, they would either be able to reach out to myself or yourself to discuss further. Thank you, everyone, for attending, and thank you, Associate Professor Guinto, for your time and for sharing with us today.
Thank you so much and looking forward to our collaboration. Stay safe.